introduction, I think that would be great. And then
Consider it done. Yeah, so good afternoon or good morning, wherever you're joining us from. Thanks so much for hopping on. In the time of COVID-19, we've certainly tried to shift our webinar series to very pertinent solutions during this time. I know health providers are grappling with a great deal. So first off, thanks to everybody for hopping on. Certainly appreciate everything you and your organizations are doing on the front lines of fighting this virus. My name is Carson Hetty. I'm the account executive in St. Louis for Microsoft Health and Life Sciences. Today, we're going to be hearing from Nucleus IO. Their data archiving solution has certainly played a part during this time with the ability to not only replace physical CDs, but also archiving solutions around a great many things. So they're going to talk about a few different use cases, present, and then also have a demo of the solution. So without further ado, I'll turn it over to Jordan Mole.
Yes, hi everyone. Appreciate you guys all jumping on the line, and I definitely want to echo that sentiment that Carson just did about everybody, the healthcare providers on the front line. So some of you may be familiar with us, Nucleus.io, Nucleus Health. You may actually know us as StatRad. So StatRad is our teleradiology arm of our company, and you may know us as StatRad as we do night reads. So nights, weekends, holidays, we actually work with radiology groups. So over the past 20 years working as StatRad, developing the clinical arm of our company, we have about 80 radiologists today that are actually reading remotely and providing actually over 1.2 million reads a year now to over 500 facilities across the US. So over the last 20 some odd years of working in the teleradiology space, we've actually developed our technology solutions, which are all in-house and homegrown. And we started leveraging what we've learned about getting images from hospitals via our edge server, and then routing them over up into the cloud, and then allowing our 80 radiologists to all read remotely. We basically have said, regardless if you're using our teleradiologists, you can use our Nucleus platform, our Nucleus solution. So basically, the engine that powers our radiologists to provide those reads. And so mostly today, we'll probably be focusing on the Nucleus platform, which is really that technology to hopefully help some of your clinicians and your radiologists to start potentially reading remotely and accessing images from without having to be located within the facility like we're doing on a nightly basis. So some of these problems that we're facing today, even pre-COVID, and a lot of the stuff that we're getting from our actual customer base is really the lack of care coordination across facilities. So as you guys may know, I mean, it can take days to just get information from across town, really from one facility to the other. And some of our clients here in San Diego, which is where our corporate headquarters is based, it takes them a week just to get an individual's images to go from the Scripps healthcare system into the Sharp healthcare system, which is located literally across the street. And so we have this disparate imaging amongst facilities and a lack of access for these clinicians. And we want to make sure that we can facilitate the connection between these two facilities and facilitate the connection between doctors at both facilities as well, where they can access images without even actually seeing the patient before the patient ever arrives at this referral site. So focusing also on the increase in volume that we're seeing today, which obviously we're not really seeing with COVID, we're seeing a drastic decrease in that, but that's only going to come back as elective care procedures are being pushed off. I mean, I think that this is going to come back more than ever with these volumes. So it's really making our radiologists and our clinicians as effective as possible when they're doing their reading. So today, our radiologists, as we know, there's a shortage and volumes are only going up. So we need to make them as efficient as possible, giving them as much access as possible, as few clicks as possible in order to make the diagnosis and return these reports back to the hospital in a timely manner, which is what we see on a nightly basis with StatRad, where we're primarily covering ERs and strokes, trauma centers, where we need to get reports back within basically 30 minutes or less. So it's making our doctors more efficient and allowing them access, but not just radiologists, but also these radiology departments. where they can see more patients and start driving revenue. So if they can get access to prior exams from a referral site, then they can start scheduling more surgeries for these incoming patients. And then also trying to replace some of these legacy on-premise solutions, which really have kind of been mirrored in the mud a little bit, where they're expensive to upgrade as they come end to life. And while we do everything, Nucleus is 100% based within the cloud. We're 100% cloud native, and that's where obviously Microsoft comes in, who's been a great partner for us. Our entire platform has been built within the Microsoft Azure cloud. We actually signed one of the first BAAs with Microsoft back in, I want to say 2014, really focusing on being infinitely scalable, which is something that we're not seeing today, where we see some radiology departments kind of limping along on these legacy solutions. They come to life, and then these upgrades are rather difficult. But with us being 100% in the cloud and infinitely scalable, we actually can do our releases, we can do our updates, and we just do it all within the browser. So our platform is 100% cloud-based and browser-based. So it allows us the functionality in order to do that. And if we want more archiving, if we just basically, Azure's allowed to do that on the back end. So they have hundreds of people focusing on the back end, which I'll let Carson talk about with the Azure infrastructure. But one of the nice things about our platform is that it can be deployed not only within our tenant, but also within a customer tenant if you guys have that direct Azure subscription already. Really what I want to say is for the primary takeaway from really this slide, and then also what you're going to see from the demo itself, is really any image, medical image, primarily DICOM. We can do a little bit of non-DICOM, but any image within a radiology department, anytime, any place, anywhere, as long as you have access to the internet, you can access those medical images. And that's both in network and out of network, which you can get an idea of here. So we're not just focused on providers, we're also focused on the entire ecosystem. So we're talking about sharing images from hospital to hospital, from provider to provider, but we also include patients within that. And then in today's day and age with COVID, this is something that we actually have some clients that are using this as a COVID response, where they're saying to their patients that maybe for a medical emergency, they need access to images, or they need some surgery that's coming up for, they're finally allowed to do elective procedures, and they want to get access to imaging that's been done at another location, but they don't want to go into the hospital. They don't want to be exposed to anything, and they want to basically prevent exposure as much as possible. You can actually utilize our platform to share directly to patients, giving patients an active control in their care, which I think is very important when it starts to build stickiness within the healthcare organizations. It provides stickiness with the providers as well, where they're taking this active, engaged approach by allowing them access to their medical images and allowing them to then go along and share them to individual providers if they like. Medical device, we work with some of the larger medical device companies out there like Medtronic, where they need access to medical images. They might service a dozen hospitals in a region, and they need to get imaging from maybe an outpatient MRI, get imaging from there, input it into their medical device to do their surgical planning. So they utilize the Nucleus platform, which is all web-based, where they can just send a link to somebody, they upload the images into the Nucleus cloud, and then from there they're able to download it into their medical device, do their surgical planning. And then even in an exam room with a patient or a surgeon, they can actually pull up the images using the Nucleus platform. And then lastly, as a clinical SaaS application, so basically we can be the platform as a service. If somebody has, like for instance, we work with some tumor boards where they're doing tumor tracking and they have all the back-end tools which they need as far as building the tumor tracking, but they don't have the viewer that comes along with that. So they actually can build their solution on top of us. So we'll touch on a little bit of that as far as image sharing. We'll touch on remote reading for radiologists, which I talked about before, and then the archiving, as I mentioned, which is infinitely scalable in the cloud with Microsoft Azure, and then cloud packs as well. We'll show you how we can be kind of an overlay packs, and then where some of our clients are actually using us to replace their on-premise legacy solutions. Here's an example of some of our customer network. And really the only reason why I like to show this is to really harp on the security aspect. So as you guys know, security is always paramount, which is, again, one of the reasons why we do work with Microsoft Azure, which I still believe is the largest HIPAA compliant cloud service out there today. We also have the FedRAMP security clearance within Azure. We do service the Bureau of Prisons, so we have gone through the federal security aspect of it as well. But I think also just navigating what it takes in order to go through these security reviews and get installed. Today, we service over 5,000 organizations, maybe 500 or so of them are actual clients, some of them being healthcare, health systems, some of them being hospitals, some outpatient centers, freestanding ERs, radiology groups. So we have the whole gamut there. And really, when we talk about edge servers is all it takes. That's the light footprint. That's really all that we need on site within a hospital system or within an imaging center or anywhere that is doing imaging. And again, we're really focusing on DICOM imaging. So radiology departments, cardiology departments as well. If you look on the right side of this PowerPoint here where it says health system, the only thing that we need on site is that edge server. So that edge server is a lightweight server. It is simply a gateway. So that is taking images from the PACS, or if there is no PACS there and they want to utilize us as a PACS, the images are coming directly from the modality. And then the images are then routed, compressed and encrypted and routed over port 440 and over the internet into the Nucleus cloud environment hosted in Microsoft Azure. And then from there, that's where you're able to do anything that you need with it. You can share it to patients, you can share it to providers, you can share it to PACS administrators, anybody that needs to ingest it. And what's nice is you'll see that the server itself is not required for the individuals to access it. They can still upload and it can go back and it's a bi-directional. So they could upload into Nucleus and then from there, your health system could take the images and you could push them and save them into PACS. And we can create rules where you can edit the information, the DICOM metadata, you can edit that information prior to saving it into your PACS system. So a lot of people use this to replace VPNs that take some time, that are maybe not quite as secure and don't really have the reporting capabilities. So some of our clients have dozens and dozens of VPNs, and they're saying that we just want to get rid of all of them, and we want you to be that stopgap. So we can open up multiple ports on that server. Port 1 can be, hospital A, port 2, hospital B, port 3, hospital C, and then you're sending directly through Nucleus with these auto rules, and then you'll be able to run a monthly report on there to say, this is how many times I've shared to this individual, or this is how many times they've sent over to us. So it's a great way to connect you with your referring community. And we'll show you how, even if it's somebody is not one of your referrers, like a one-off share, we can do that as well. And here we have a little bit of we call it the Nucleus cloud journey, or a journey to the cloud. So we have multiple solutions here, and I've kind of touched a little bit on each one of them. You'll see the image exchange side of things, which has all the things that you need as far as connecting with referring providers, to sharing with patients, to other facilities, and then it grows from there. So if you actually look at that last slide I was going through here, so let's just say PACS does go down and there's an X over that PACS there, and you need your modalities to send to Nucleus, so that way your clinicians, your ER doctors, or your radiologists want to do a wet read or do a final read within Nucleus, they can do that until PACS comes back up. So we can actually serve as a downtime packs. A lot of people utilize us as a downtime packs, even just with our radiologists, where we do the reads for them in the evenings for StatRad. But this could just be, if you go down an unplanned downtime during the day, you can just have the modalities sending to a router, which sends to us. And then your patient care doesn't need to stop. You don't need to have doctors reading off the modalities. So downtime packs, remote reading is really when we're talking about radiology groups. So we work with a lot of radiology groups out there that cover multiple facilities, so some of our partners, basically, they could cover 4 hospitals that have 4 different PACS systems, 4 different voice recognition systems, 4 different work lists, and they're doing the swivel chair, right? So they're going have half a dozen monitors set up, and they're sliding back and forth with 4 different mics, picking up their mics. And what they're looking for is basically that overlay, that remote read, that overlay packs, which is really what we do with StatRad, is where we're sending everything to one platform, and they can do the dictation there with a unified work list, and then it goes out to which system it needs to go to. So the report is then sent back to the correct hospital. They can use one voice recognition system, one work list, and service multiple hospitals that might be on disparate systems. And then, of course, the cloud packs, which is just basically replacing the entire pack system that used to be located on-premise, but now the only thing that we have to put on-prem so we can start reducing data centers is that edge server. That we call it our edge server, a gateway server, which is compressing, encrypting the images, and sending it up into the cloud. So I hit on all of these, and I'll just give them a quick overview one more time on each one of these kind of workflows. But I do think a lot of the benefit is actually coming within the demo itself, which Courtney and I will do together. I'll let Courtney probably share some of that first, and then I'll go through a few workflows. But image exchange, so again, to highlight some of the benefits, some of the bullet points there, we're trying to eliminate CD burning, so connecting you with your entire referring community. Everything that we'll show you today is completely web-based. It's all done within your browser. It is zero footprint. We can work with Chrome, Safari, Firefox, Internet Explorer. Anyone that has access to the internet, you can access medical images. And then getting into the HIPAA tracking and the security, I think is extremely important in the data encryption in transit and at rest, which some of the other vendors out there that specifically just do image exchange, and not everybody is encrypting in transit at rest. So I do think security always has to be paramount when we're talking about PHI. The remote reading workflow, just to hit on this again, is basically pulling everything into the cloud. And what we do a little bit differently to give you the speed is we do, with remote reading, we do client-side rendering. So a lot of the zero footprint viewers out there, the reason why people haven't gone pure cloud before in the past is simply it just hasn't been performant enough for that. And we think that we, with our patented streaming technology and utilizing the client-side streaming technology, we have finally given some of our clients that performance that they need. So we're giving them as good as performance as they would have if they're just logged in, in their reading room at the hospital, but now they're able to do it from home. As long as they have their laptop and another monitor, they're good to go and they can start reading. So with client-side rendering, what we do there is it helps overcome latency. So we're unlocking the power of the laptop, of the cell phone, of the client's device, so the client itself. So we don't have to go ping the server. So when a radiologist is window leveling or manipulating an image, people that the traditional use server-side streaming, what happens is it goes and pings the server wherever the server is located, processes on the server, and then it then displays on the device. We basically do all of that within the power of the actual web browser and on the client itself. Downtime packs, I hit on this. I think this is somewhat self-explanatory. So you have your modalities pointing to a DICOM router, pack system, keeps going down. Packs goes down, and you send this router, send the images directly over that edge server into Nucleus. So as long as you have access to the internet, you have a backup ISP. If internet goes down, you can still send images into Nucleus, and all of your clinicians can still access the imaging as long as they have access to a device, a cell phone, tablet, computer, any workstation, walking into any exam room, they can still pull up medical images. And the PACS workflow, it's typically we're integrating with, we list Epic there as they're the 800-pound gorilla, but we can integrate with other EMRs as well, where maybe that EMR, if someone wants to use our workstation, if someone wants to use our work list, or they want to use their own work list, we can integrate with those things if they want to use our voice recognition platform, or potentially just continue using PowerScribe. So some of our clients, they'll have Epic, we'll launch the instance of PowerScribe, and they'll launch the instance of Nucleus, the viewer in the other window, and then the reports are then sent directly into Epic, and then a copy is sent into Nucleus, so you'll have most recent there. Again, scalability is extremely important. And then speed, being able to pull the speed of the image just like an on-premise solution. Lastly, security. We can send out our security white paper, maybe with some of this recording, Carson, and any information you need on that, as well as utilizing Microsoft security itself. So we like to say that we kind of have a vault within a vault. We utilize Microsoft Azure security. Then we have our own infrastructure security as well. And then we actually encrypt every single image itself, has its own separate encryption key. So then we have additional security on that. So if somebody for some reason needs to access that, then they're only going to see a bunch of encrypted images within there. And we'll send out that information. I don't have any other slides that I really want to get to. I do think getting into the actual platform would be beneficial. Was there any questions for me at this point before we get into that? And this can be working if somebody wants to see a specific workflow. I mean, we can definitely get into that as well. No? Okay. So you'll see here, I'm utilizing Google Chrome. Google Chrome is our preferred browser, only because when you're built within the browser, no Java, Flash, or download client installs or anything like that. Working within the browser, the most advanced browser out there right now is Chrome. With that said, Internet Explorer works just fine. We can utilize Internet Explorer, but just for the purpose of this demo, I'm going to show using Google Chrome, but we absolutely can utilize Internet Explorer as well.
Feel free to check out Chromium also.
There you go. So we can obviously, we are trying to keep up to date. Internet Explorer is clearly the most widely used browser out there. So we obviously need to be able to be just as performant within that. But just for the purpose of this, my demo, I'm just going to show it within Chrome, if that's okay.
That's okay. I know people that use Chrome, so.
Yeah, okay. We're not bad people, I promise.
No.
So if we were looking at, and I'm going to lightly touch on, different workflows. I mean, if we're going into a PACS demonstration, that demo could, we could spend hours on specific PACS workflows and PACS needs. So I'm just going to do a general overview, and then I think as maybe individuals if they have more interest in certain items, we can bring in my product analyst so we can identify specific workflows. So as you can see here, I'm just logged in. I have my username and password saved in there. We can also integrate with Active Directory through LDAP, so you can have your permission-based logins there, single sign-ons, things like that. But if I come into this one organization, so you can be part of multiple organizations, which is also nice. So if you're in a health system and if you have 3 different hospitals, and for some reason you keep the radiology department at hospital 1 separate than the radiology department at hospital 2, or for instance, maybe radiology and cardiology, you could have one roll up where you have a group for radiology department and a group for the cardiology department. So you can keep individuals, their info separate, and then you can even dive down further in there. Let's say you want to have women's imaging has their own group, or orthopedics has their own group, surgical consult has their own group. We can build that out so that way the individuals will only see what they should have access to. But working out of the demo hospital here, sharing images with an individual is just as easy as coming in here and clicking the share icon. And then from here, they can either search the directory. So for instance, they could search for the customer demo here and they want to share to that facility. I've already shared it to this hospital, but you could share to multiple organizations. You could share to one organization. You can actually highlight somebody as a favorite. So you have a favorites list here, so you can see them listed here. But let's say I wanted to give this we'll go to the sales organization. I'll just send it to them, and I want to share it over to them, and I just share it, and I'm going to give them no expiration, or I want to give it to them for the next week. I can share this exam, and that will immediately be sent over to that sales organization here. and you'll be able to see this is that Hanging Harriet study. And if they want to view the images, they're able to view the images. So that's just looking at imaging within, sharing within your organization. So you'll see here, this all popped up in another browser. This is just our image exchange viewer, which is still extremely fast. There might be a little delay over Teams, but we utilize that client-side rendering, which allows me to get no latency when pulling up these images. You'll see here too, I can actually pull up prior exams as well, and I can look at those side by side if I wanted to. If I close this out, it's zero footprint. Nothing is stored on this device. There's no download necessary. A lot of this is basically sharing within your network. So you could share within the entire Nucleus organization, our platform, where we have thousands of users, and you could pull them up and you'd be able to select them. You can share directly to providers. You can actually share to patients as well, where we match up information within the DICOM metadata, so name, date of birth. That information needs to match. So when that recipient receives the images, they actually need to register. And only if that information matches are they actually able to view the images. And then we have stat share. So stat share, what's nice about this is it allows you to share outside of your network. So let's say you're transferring a patient, or for whatever reason, somebody calls and says, I need this access to Hanging Harriet's patients immediately. You could come in here, and regardless of if that individual has a Nucleus account, you can still share to them and they're not required to register. So let's say I want to give it to I'll send this to my account. I want to give it to for 7 days. I share the exam. The only thing that's going to be put on there is a passcode. And what's nice about this is I'll get that email here. And the only thing that it's going to ask me to do is input a passcode, and then I'll be able to view those medical images. So the whole point of this is we want you to be able to share both in your network and out of your network, regardless if they have a Nucleus account. So we have some individuals that actually utilize this for stroke workflows and things like that, where they need to do a quick collaboration and they need to get access to medical imaging immediately. Then they utilize this. And this way, you'll see, obviously, there's times where people don't, they don't want to register for new accounts and things like that. As we know, most doctors don't want to do that. They want to use one platform. So we can create these auto actions as well. So then we can also see here too, even if studies get deleted, we'll be able to see, depending on what is looking so you can see, okay, was this shared, was this viewed, and this hasn't been viewed yet by the individual. So, and I'll pull that up in a minute here. And we can see HIPAA logs as well, which are all exportable. Reports would go along with it as well. So I think what's important is showing here is regardless if you're sharing within the Nucleus network or out of the Nucleus network, you're able to share multiple images. And then from here, you can actually get into the automatic actions portion of it here. So if you wanted to create an automatic action for, I mentioned like a neurostroke, neurostrokes, and you wanted to have a specific group. So anytime an exam is uploaded into your account from a specific modality, or maybe there's a referring physician, Dr. Neuros in the DICOM tag, you want to automatically send a text message to Dr. Neuro. You can put some patient information in there. So a new exam, created on this date, you can send an email to that individual, send an email to them, and then you also could tell them, and this is all customizable, log into Nucleus for new stroke patient, and that exam is shared directly into their personal account as well. So we have set this up for some of our clients where they say, okay, we have a group of neuroradiologists that read for the entire community. So anytime an incoming exam has some sort of trigger on it, they get an email or text message to tell them, log on to any device that has access to the internet, and they can view those images. And then this can be, I mentioned, as far as auto actions, you could use this as a way to auto share to individuals, to automatically download it into your packs, to push to packs. So we can set up trigger events where you don't actually have to operate within Nucleus. You can just from your packs create a new destination, and it automatically is going to share out to another organization. So that's a lot of the image sharing side of things, but we can go a step further and look a little bit at the pack side of it as well. So you'll see here with this organization, I have what this sales organization, I have an additional reading work list here. So this is our work list, and we can dive in, individually with users from a more perspective as far as what sort of workflows that they need. But with this, we have a more advanced viewer that a radiologist would likely need. One of the things I can pull up here is mammos, which a lot of people struggle with or choke on. It's actually something that we do quite well. So you'll see this is a large mammo. If I come in, I can actually pull up. So if I go through and I want to look at, we'll just look at one of these tomos, and I drag this tomo over. You'll see this is a really large study. This is multiple gigs. I think this is 2.8 gigs. And I can come through, I can window level, I can do scroll stack, I can zoom, do everything that's necessary, pan and whatnot for this. So it does say here we're not cleared for mammo. This is the only modality where we actually don't have FDA clearance, although we are submitting it come July. So we should have it. I was on a call yesterday. We should have it by August of this year for mammos as well. So we do have all the features. It's just, if you can imagine from a teleradiology perspective, there's not a whole lot of mammos that are done. So it was kind of the last thing on our product line that we wanted to install. But you'll see here we do have hanging protocols, and we have short keys, which you can go through. Again, this is an extremely large study, and I'm able to just pull this up through my browser. So there's nothing stored on my device or anything like that. And these hanging protocols can all be set. I'm working off of one monitor, so it's a little bit difficult to share screens, but you can create your own hanging protocols per users. So again, zero footprint, it's closed, take that off. But if we go a step further, so this is an interesting study. This CTA here is about 1,000 slices. And I do think this shows a lot of our capability. So as this image is pulling in, and you might see a little delay through Teams, but you can see even as it's pulling in, I'm still able to manipulate the images. So it gives you the low fidelity first, and it loads in the full fidelity in the background. So you can see it gives you the lossless compression. And then as you're scrolling through, you're still able to manipulate the image and do what you want with it. What's nice from here is even as this is loading, and again, this gets to that client-side rendering. This is being all done on my device. So it's not having to ping the server. That's how I get no latency and no loading. But even as it's pulling in all the images, I can drop into an MPR view. And this is just a thin sliced CT that is sent us, and we are doing all of the recon on our side through the browser itself. So see, I'm able to pull in the actual, and now I've created the sagittal and coronal views, and I can scroll through these. And even from MPR, I can now get into MIP. I can change the slice thickness. Let's say I want to take a better look, at the lungs, and I want to give it a lung. And you can see, if you notice here, these are all the hotkeys that are associated with these. So as not being a radiologist, I'm not akin to using them very often, but you can see all the hotkeys and all these, all the DICOM tools have hotkeys, which you can create. And now you'll see here, I've created the thickness. I can zoom in, and let's say now I have a better shot of the lungs here, and I can scroll through. We can even take, we can come in and let's say we want to take an oblique view. I want to change the slab thickness over here. I can turn the reference lines on and off. What's really fun about this, from a sales perspective, is this all being done in the browser, and this is all customizable. So we actually can do, I don't think I have it turned on, but I'll reload it in a minute. But from here, I can do a non-viewer, this is our non-viewport window. So not everybody likes to see. So if you can imagine, a radiologist has multiple monitors, and I could drag this onto my other monitor. And let's say they want to have just a full diagnostic view on one end. If you just bear with me here, you can actually have this all customizable. And let's say I want to see, okay, my hanging protocols, if I'm using the Nucleus dictation, the voice dictation, So it only takes just a minute here. I want to look at my searings down there and my key images as well. So now I've customized this page. And if I want to have just my work list in one view over here, I'm looking at my series, and let's say I was just dragging this and this was on my other viewer, I can come in here, and now if I just go and now I have a full screen, and this can be my diagnostic window. And then on my other page, I'm going through my work list here. So let's say I'm going through my work list and I have a particular filter set up, then this is just pulling through, and I can have hotkeys going set up here. So you have, this is getting back to basically saying, I'm working off of a laptop right now, and all I have is a monitor hooked up into my laptop. And I'm even using a portable monitor that I use when I travel. And that's so, a radiologist is out of town and they want to see something from home and they want to see something from a hotel room. They can do this, and they can actually continue to read and go through their shift while just clicking through, and just all they need is their laptop. So there's nothing special really about this setup. Let's get back out of full screen here. We also can do PET CTs here on the fly. I think that's important to show. Again, we're doing the recon here. Oh, I still have it. My manipulations in the other window. But you'll see here we can do PET CTs. So we're doing the fusion. Let me just do a quick reset of my layout. Just for the demo's sake, I think it's easier to see if I reset this back to this. So I have my series here. Okay, and it's pulling all the images. So let's say I wanted to even do the fusion by myself. I could take the CT, and then I can drag over the nuclear study directly over. And let's say I want to do the fusion overlay on my own. I can build the fusion overlay, scroll through, change the opacity, change it all the way to just look at the CT, just look at the nuclear study. And you have different views here for our radiologists. So I'm obviously not a radiologist, but we do have 80 radiologists today that are testing and working off of our system. So, which is nice. We get immediate feedback. And as many of you know, radiologists like to provide that feedback. Is there any other types of studies that maybe anyone would like to see that I can go through? And I can actually show another interesting tidbit, but Carson or Courtney or anyone that, as far as workflows that they would like to see, maybe that I've missed. I know there's a lot that Nucleus can do, and I just don't want to spend too much time on one aspect of it. For a general group. Anything, Courtney, or anything that you can think of maybe that?
Yeah, I'll make this quick. For me, on a personal note, I got a 17-year-old who's been sick for 5 years, and we've gone back and forth between 4 different health systems, 3 of them out here, Rady Children's, Scripps, and UCSD Health, and Mayo Clinic, where Carter was born in Minnesota. And so back in 2016, he was diagnosed with POTS and a 2 by 3 centimeter mass in his left lobe of his lung. And we went up to Mayo Clinic for a second opinion from his infectious disease doctor at Rady Children's. And so we went up there, had imaging done, got a CT of his lungs. The disc was mailed out to us. And frankly, when we got back to Rady Children's, handed it to the nurse and Dr. Bradley, infectious disease, it never did load. They had emerge packs. And the images, we went back to Mayo Clinic 3 times that year for second opinions and continued imaging, and never once did it load in. And so that very first appointment, I'll tell you, it was pretty interesting. The disc got the spinning wheel. I actually handed my doctor my Samsung S6 Edge phone and detailed it. He grabbed it and started detailing the images of my son's tumor. And it was benign, but the good thing was he looked at me right in the eye, and Jordan showed you that stat share. He instantly said, "Can you share this with me?" And I said, "Yeah, absolutely." So within a minute, he had it pulled up, the study on his 2 monitors. I sent it to him in a stat share, which I knew he didn't have an account, so I was able to share it to him and save the day. And so from this point on, going forward, it's been a godsend for our family and dealing with imaging from his Lyme disease to POTS to valley fever and this tumor. The idea is if I get an image or a disc from anyone and I need to get it to another specialist, they all have their own Nucleus accounts now. So to make a long story short, it's been a great deal for communicating those images without having him. He's had a lot of radiation over the years, and no need to rescan him if there's a way to get those images. So it's been a great opportunity for that, and it's just so simple how easy it is for patients to use and referring physicians to use. So that's the only thing I wanted to add.
Yeah, and I wanted to show here, as Courtney was giving that story, thanks, Courtney. We also can do volume rendering here, which I don't know if there's anyone out there today that can actually do this within their browser. So if you'll see here, this is one thing that a standard laptop. So I do have a video card on my laptop. It's basically a gaming laptop is really what it is. I think it costs like $2,000. But it allows you to do this 3D volume rendering. What you see, I just manipulated and I pulled that up. So from that individual image, I went over here and then I have these layouts here, and I went over and I was able to select this volume rendering view. And then from here, I get a whole comprehensive view of this individual, and I can come in and window level, I can change these presets, and I can look at, a comprehensive 3D view of this individual to make a diagnosis. And from there, I can actually even do like center line, which is really important as well. So if you bear with me. So now I'm getting that oblique view so I can see and you'll see this takes that center line. So not being a clinician, it's supposed to track the aorta all the way through, which you can see here a little bit. And then I can come in and I have this 3D rotation, which I'm able to do all directly through the browser itself. Window level, etc. Without any delay, without any latency, which is the key part. So again, trying to give you the same speed that you're getting from an on-premise solution, but doing it directly from the cloud, overcoming any latency. We can prefetch exams if you want us to be in overlay packs, we can do that. And then also I'll just show you one last thing here, which I think is interesting, is a partnership that we did before with Microsoft, where they actually built some of their AI off of us. So Microsoft InterEye, which Carson, you might be able to speak to, but they actually wanted to build their InterEye program off of our platform. Not off of it, but they wanted to be able to display it, with their viewer. So you'll see here, we just gave them really our APIs, and then they were able to utilize our open APIs, and then they're able to, this way we're able to show, say, InterEye, which is really focusing on, so you see all of this was done by the Microsoft InterEye, and we're displaying this, and we can come in and get a better look at, where the radiation needs to be displayed or performed within this particular patient. So that's all Microsoft's InterEye built or displayed on the Nucleus platform. There's some other AI we can do as well, where it's not really us doing the AI, it's more so individuals doing the AI. So I mentioned some tumor boards. So Aidence is another company that we've worked with before. Well, again, it's mostly us giving them our APIs, and then they built it on top of that. So they wanted to do volume tracking for tumors. So you'll see here, this, which is basically turned on through GSPS, they can come in and they'll see, okay, they've shown here's a nodule that they want to view. And then from here, they're showing it over time, the analysis of it. So the growth of that, this is all their platform here. And again, as I mentioned, we're supporting this through GSPS Grayscale, so I can, as an overlay. So individuals can build off of this as well. It's a very versatile platform. I think there's one takeaway from this entire demonstration. It is getting into the aspect of utilizing the cloud, so that way you can access medical images any place, anytime, anywhere, As long as you have access to the internet, you can pull up medical images and get the same performance that you would get from an on-premise solution. We do it every single day. Pre-COVID, we were averaging about 3,000 reads every single night, primarily coming from ERs, where our radiologists are getting images, strokes, traumas, critically ills, and needing to make a diagnosis and return those in 30 minutes or less. And we read for over 500 facilities today. So having to be able to take images from all these facilities with doctors that work really across the world. We have some in Europe, with Hawaii, and then across the continental US, make these images, get this diagnosis, prefetch priors, necessary priors, and then dictate the report and have that report populated within a hospital EMR, within a hospital PACS immediately, so that patient can get the care that they need. And then, of course, in the instance that, say, Courtney provided from a patient perspective, allowing patients to basically see doctors, referring doctors, get access to images, and get the care that they need without having to wait for a CD, without having to go in and potentially be exposed to diseases, COVID, things like that, where now they can get images and they can continue the care that they need for their loved ones, utilizing the Nucleus Platform, utilizing StatRad teleradiologists, which again is just all empowered by the Microsoft Azure cloud. So with that, I don't have much else, Carson, unless you have questions that you wanted to ask or anything you want us to go through.
No, this is pretty comprehensive. Definitely appreciate the presentation and discussion. Again, the sessions are recorded as well, so I know it will live on in that form, and I can certainly make that available after the fact. So I don't know if there's not any other questions, we can go ahead and close out, and then I will publish the recording.
Great. Well, I appreciate everybody's time. And we can do a more comprehensive or detailed demos for any individuals that want to take a look at specific workflows for their facilities. We'd be happy to do that. But appreciate everybody's time today, and thanks for including us.
Yeah, and one thing too that I want to add is certainly in this time, we have a lot of different Microsoft resources that are available for virtual sessions, namely in our Microsoft Technology Center. So an area that I've seen some success is architectural design sessions that we've done in tandem with the Technology Center resources. So certainly would want to avail that. That is a value add for all of our clients. So certainly if you have any questions or would want to pursue anything of that stature, feel free to reach out. And then let us know if there's any other questions or if you'd like to get a copy of this recording. And that said, we'll go ahead and end the session, and have a great day and stay safe.
Great. Thank you.
Carson. Thank you, Jordan.